or still morning, you guys. Today we're here, 11 o'clock. We're going to get started with our Getting It Right panel, strengthening and empowering vulnerable communities through collaborative support. My name is Stephanie Duke. I'm an attorney at Disability Rights Texas, doing all things disaster, emergency, and disability related. And I'm going to let the rest of my panelists introduce themselves first. Oh, I'll introduce Lex in a second, yeah.
Awesome. Thank you, Stephanie. I am Meridith Silcox. I am the chair of the Houston Commission on Disabilities. I am also the ADA administrator at NRG Park. I have worked in the disability field for about 16 years in various capacities, and I'm excited to be here today. Thank you.
Thank you. Ron?
Oh, I have my own. Good morning. My name is Ron Lucey, and I'm the executive director of the Texas Governor's Committee on People with Disabilities. And I've been serving Texans with disabilities for over 35 years, working in various fields, including healthcare, vocational rehabilitation, and special education. Thanks for having me.
Good morning, and thank you for the opportunity to contribute to this. My name is Mark Gowen. I'm the president of Angel Medical Supply. We are a Houston-based provider of durable medical equipment, specializing in respiratory, like ventilators and oxygen. We primarily service the medically fragile children and the special needs population, though we do work with adults as well. I've been in this 30 years, including my tenure as a Medicare fraud investigator. So I've witnessed the critical gaps in care, and especially the delivery of DME in disasters.
Thank you, guys. We also have another member joining us virtually, Lex Frieden, I don't know, as an educator, researcher, disability policy expert, and disability rights activist. Lex has been a chief architect of with the Americans with Disabilities Act. He's also regarded as a founder and leader of the independent living movement by people with disabilities in the U.S. He has worked on a variety of congressional task forces, led the National Council on Disabilities executive director, and also appointed by Bush as chairman. He is also professor of health informatics, of physical medicine and rehabilitation at the University of Texas at the Health Science Center in Houston, and an adjunct professor of physical medicine and rehabilitation at Baylor College of Med. Lex directs the Independent Living Research Utilization Program at TIER Memorial Hermann Hospital in Houston. With that, he unfortunately cannot be here today, but has sent a video for us to watch real quick. So let's give a look at that. All right, well, we'll go ahead and start with our questions then for the panel and see if we can get that audio and recording sorted. So
the next best is
our guys here as our panelists and experts have all been doing work in disasters and emergencies. So I want to start with, actually, Mark, we'll start with you. How has your job or professional career been impacted by disasters and emergencies?
Actually, working at Angel Medical, the disasters and the emergencies have actually directly shaped and tested my my position. I've had a front row seat in how the disasters impact the vulnerable communities. These events have, with the COVID, with the emergencies, with the freezes, the extended power outages, companies like Angel Medical had to step up to meet the moment. And what I mean by that is during many of these events, companies like Angel Medical and a lot of the medical suppliers provided free medical supplies, oxygen, ventilators, ventilator batteries, and all of it at our own cost. So these basically affected us financially because we're a small company, but also emotionally because during some of these freezes, especially during the freeze, there were many patients that we couldn't get to, and it kind of it was tough that we couldn't get to them, and so it was an emotional burden on me.
Thanks, Mark. Ron, same question to you. How has your job or professional career been impacted by disasters and emergencies?
Well, my career spans over 3 decades, and my first hands-on work in emergency management goes back to Hurricane Katrina and Hurricane Rita, where the city of Austin served as an evacuation hub for people evacuating from New Orleans, and then later those same evacuees had to evacuate from Houston to Austin due to Hurricane Rita. And our policies and procedures for supporting people with disabilities looked a lot different back then than they do now. We did not have inclusive sheltering, and we didn't have plans in place to ensure effective communication for deaf evacuees. And so we were literally planning and responding on the fly, responding to the needs of a busload of deaf evacuees coming from Houston looking for a shelter. Each one of the disasters that I've staffed, whether at the city level or at the governor's level, has been a learning experience. And I've discovered in my career, learning should not be this painful. We should be taking those lessons from different jurisdictions and being more comprehensive and inclusive in our planning. Hurricane Harvey was the next tough lesson for this community and also for the governor's office, where the governor's staff were staffing a call center in the governor's office in 24 hours for several days. And the calls continued to come in for months after that, people struggling to recover. So each disaster that this community is affected by, we are listening, we are paying attention, and we are trying to increase the speed of learning and make not just Houston more resilient, but make Texas more resilient.
Thanks, Ron. Same question to you, Mary.
Thank you. I wear a few hats in the disability community. I am the ADA administrator at NRG Park, which we all know is a large sports complex here in Houston. And my role there is not only to make sure our venue and events are accessible, but it's also to make sure that our emergency plans incorporate and account for folks who may be attending an event who have a disability, specifically in evacuating a large venue like NRG Park, focusing on mobility, limited mobility guests. So working specifically, putting together a collaborative team to focus specifically on what that evacuation might look like, what various emergencies might we be focusing on, worked with our security department, event management, guest experience, really layering in all of their input from an event perspective, and what does it look like I said, to evacuate folks with limited mobility, making plans specifically for the NFL season, but also looking at larger events. So we host a lot of large national events. As you know, we've hosted, we're getting ready to host a World Cup events, and what does an event like that look like? And when we're looking at those large national events, we collaborate with the City of Houston's Office of Emergency Management, because they're going to be heavily involved in that evacuation plan as well. My other hat that I wear is I'm the chair of the Houston Commission on Disabilities, and we collaborate closely with the Mayor's Office for People with Disability, our Office of Emergency Management, the DAFN Roundtable. And how are we planning in advance for emergencies, as Ron was saying? How are we preparing in advance for these emergencies? And how are we responding in real time when we're in an activation? So working closely with them, making sure that folks with disabilities are at that table, right? Looking around the room and making sure there's representation from all walks of disability. How are they engaged? Are we getting input? And making sure that those voices are heard once they're at that table.
Thank you. So, Ron, next question for you. Meridith was talking about that collaborative approach and inclusive planning. So how can individuals, family members, get involved to advocate and empower themselves?
As we know, all disasters are local, and that localness of these disasters starts with the family and the household, and then up to the neighborhood level, up to the community level, state, national. And at each one of those levels, it's possible for that family to be included in those local disaster plans. I think it starts with getting to know your neighbors, get involved in your neighborhood associations. There's an excellent training for people with intellectual and developmental disabilities that is a neighbor-to-neighbor training, feeling safe, being safe. And we always recommend starting as local as you can get, and then work with your mayor and your city council and your mayor's committee. The governor's committee supports a network of mayor's committees around the state. There are approximately 22 local commissions in some of the biggest cities in our state. And those commissioners, those committee members are there to represent and be the voice of people with disabilities in that community. Now, local emergency management can immediately tap that organization as an inclusive planning committee. They might want to round that out with other voices, like the voices of Mark and providers that support people with disabilities, making sure that their health care needs are met. But we want to do the planning now and not wait until the next disaster. Do it when the lights are still on. At the state level, you have the Governor's Committee on People with Disabilities, our organization, and we move our meetings around the state, and we were here in Houston in January to listen to the Houston community and learn from Hurricane Beryl and how that impacted your community. And your voices influence the policies that we bring to the Texas legislature. There's a pretty substantial section of our biennial report to the legislature on emergency management, and right now that's being informed primarily by a couple of recent disasters, Winter Storm Uri and Hurricane Beryl, where Texans lost power and it had an upsized impact on Texans with disabilities. If you want to know how to influence policy at the state level, at the Disability Rights Texas table, we have a flyer that has a QR code that will take you to a video on how you can influence state policy. It gets into how you can make policy recommendation and public comment to the governor's committee, but then it also talks about how you can help get a bill filed in the legislature.
Thanks, Ron. And to add to that, you know, inclusive planning obviously is huge from public, right? Our public partners who are providing those emergency support functions have that representation at the table. But Mark, to you and being a DME provider, how can you better prepare consumers that you provide for?
So, and I wanted to elaborate on that as well, because that is important, that our patients, we try to get them involved as much as we can. And because the DME companies like us and associations that I belong to can help amplify their voice with policymakers. Perfect example is we were a group of mine called TexMep. We represent DME providers throughout Texas. We were in Austin last week in the Capitol, and we brought families. We brought 2 children on ventilators that were on wheelchairs. We went to representatives, we went to senators, and we spoke to them. The most important thing that the families can do is to tell their story. And because we don't live their story, and if representation or representatives can hear their story, sometimes they act.
So, in thinking about what individuals can do to advocate for themselves in inclusive planning, reaching out to the emergency management departments, understanding your resources, understanding what potential programs can be involved, how do events like this help create that awareness and educational opportunity?
This event keeps it real for people. You have an exhibit hall full of experts, and each individual's preparedness plan is going to be unique to those needs of their disability or their family. I'm a father of 3 kids, and our family's needs are pretty specific. We have a family member with cerebral palsy, we have a family member on the autism spectrum, and I have a vision impairment. And so our plans are going to look different than the plans of everybody else. What I think makes this event special is that you have experts that will guide you in developing a unique, specific plan for each of you, and I would fully take advantage of what's being offered today. You don't get that type of hands-on experience. When you walk out of here today, you can have a plan that will address your family's evacuation and transportation needs, that will help you decide what you need to prepare for, what you need to put in your 72-hour emergency kit. You don't get that anywhere else. And I will tell you, the Governor's Committee saw something special in this event. The fact that there's special outreach to the disability community here makes this special. And it was recognized last year with a Martha Arbuckle Award from the Texas Governor's Committee on People with Disabilities. Now, we give out those awards because we want the award winners to be role models for other communities. What's happening here today in Houston is unique. We don't see it happening in other large communities. Y'all are a pathfinder for the rest of the state. So I see this event growing year after year, and let's avoid those hard lessons that we get from each disaster because we've done a better job of preparing ourselves and our neighbors.
Mark?
Yeah, and if I can elaborate on that too, what is special about this event, and this is only my second event, is that the relationships that you build when you're here. We've already spoke to plenty of people out there just in the last hour of them telling us their story. And we have built those relationships, and in a disaster, relationships is really what matters, especially with your neighbors, with people that can make decisions, like these three that are sitting next to me. They can do a lot more than I can. So, and we've got plenty more out on the floor that are decision makers with emergency management. So it's building those relationships, just stopping at those tables and talking to introducing yourself. That's what I love about this event.
Well, first of all, I agree. Ron, specifically, you were talking about the clinic that we have here and the way for folks to get that kind of navigator that's going to walk them through step by step what their plan can be specific to them and their family and what their needs are. And that's very unique. Typically, when you look online or when you maybe go to other events, it's going to be more of a global, these are some things that you should do to prepare for an emergency. And I think that really sets this event apart. I think it's no coincidence that this event is hosted in Houston. We do experience probably more weather disasters than any other region of Texas here. And I think it also speaks specifically to how our city and city officials have been connected to the disability community and are committed to making sure that we're getting it right. How is the city improving with each disaster? Do we get it completely right every time? No, I think that would be an impossible expectation. But the city certainly learns and takes that feedback and plans to try to at least do better with the next one. So I think that's how these events really can engage with the community and help those community members make their plan. But it's also an opportunity for every vendor out there to hear that feedback and what can we do and how do we understand the community and what those needs are.
Thank you. Okay, so we still have Lex's video we need to get to. We'll do that in just a second. But for our panelists, think about, once we're done with that, one takeaway to walk away from this panel. What's the most, I know they're all important, but what's one thing people should remember from this session? Okay? All right, so you guys were ready for the...
Hey guys, thank you all for being there today. I'm sorry I can't be with you in person, but the next best is my virtual self. And I wanted to be sure to drop in and say thanks and tell you how important this is, not just for yourselves and not just for me, but for all people with disabilities. We are living in a world where we know, and we are all very well here in Houston, very well aware that climate change is affecting our lives. If you read some of the more recent reports about settling in the country, about the earth changing, about the ice melting, about the oceans rising, about the atmosphere changing, you will clearly understand how nature is challenging all of us to maintain a high quality of life and to be productive. And we can be, because we have a lot of science behind us. We have a lot of wherewithal here. And we have a lot of people who really want to help and be sure that people can survive these disasters and other challenges that are thrown before us by nature. And it's not only nature. There are other kinds of threats in the world today that we have to be aware of. It could be some threat from a foreign actor. It could be some threat from a factory. It could be a threat from any number of places, but the results will be the same, and that is people with disabilities will need help being rescued, recovering, and so on. And not only that, we have to prepare. We know these things are coming. We can't stick our head under the sand. We know they're coming, and we must be prepared. Now, ADA probably provides a lot of incentive for many agencies to reach out to people with disabilities. But I don't think it's all about ADA. I think it's about humanity, and people with disabilities in our community and across the world are part of the bigger picture, part of humanity that needs to be addressed in the case of disasters and emergencies. So we're very fortunate to live in Texas and to live in Houston. Those of us who have experienced disasters in Houston, me, for example, in several different hurricanes and in Tropical Storm Allison, which was probably the most significant in my life. We lost our home in that. We couldn't get out, couldn't get food. We were really dependent on neighbors to realize we were in need of help. And even then, the Houston Fire Department, Houston Police Department, Metro, number of the hospitals, some of the pharmacies, and volunteers from all over pitched in to be sure that people were rescued, to be sure that they were cared for, to be sure that they could recover their lives. And we have, as I said, the good fortune to be here and to be here today to discuss these issues. I think it's important for all of us to be empowered, to have a voice, to be able to communicate with the emergency services. I think we have challenges here with the power. I know the power company has made a lot of improvements, but frankly, I have family members who are power dependent, and it makes me very, very nervous to think about what might happen if the power goes down for too long. So we have to be always preparing, always trying to look ahead, but I would really encourage all of you and all of us together have to work closely with the agencies and organizations that are focused on serving people with disabilities in case of emergencies and disasters. And I know a lot of those people are here in the audience today. I want to thank all of you personally. I know after Hurricane Katrina, we were serving a lot of people outside of Houston, people coming to Houston. Many of you were involved in that. More recently in Hurricane Harvey, people from Houston were rescued and saved by people from outside of Houston who were returning the favor. And that's part of it. It's having a synergy, working together, not only among our neighbors, but also among our community, our state, and our region. And with that, we can prepare, we can recover, and we need to focus on the future. So here today, we have a beautiful panel, friends of mine from many different experiences. And I hate to call out anybody in particular, but some of the advocates who are here on this panel today have been legendary leaders in the state of Texas and across the nation, not only in emergency services, but many other aspects of life that relate to and serve people with disabilities. So I want to thank the panel members. and the organizers of the program. I want to thank all of you. But remember, now the bottom line is here, nothing about us without us. Get involved, get engaged, meet those people, talk to the people who are committed and dedicated to help in case of a disaster. Become part of the solution, not the problem. And with that, let me just again say thank you all for being here. Thank you for taking a minute to listen to me, and have a great meeting.
True to Lex, right? All right. So one takeaway from today for people to remember, or we're recording this, so as a resource too. Mark, you first.
I was hoping you wouldn't go to me first. The one thing that I took away, I mean, Lex Frieden just said, get engaged. And the association text map that I belong to, we have a saying that, let me read it. If you don't have a seat at the table, then you're on the menu. And, you know, the takeaway that I just get involved, talk to the emergency management, talk to the governor's office, talk to the Houston office. Just get engaged, like Lex Frieden said.
Go for it, Ron.
At this expo, you're going to see a lot of amazing equipment and gear out there, and you're going to want to say, I can't afford it. There's generators, there's flashlights, there's freeze-dried food, all kinds of things. There's one thing you can put in your family's emergency kit that doesn't cost you a thing, and that's the knowledge and the relationships that you can form here today. Learning doesn't cost anything when it comes to helping you and your family get prepared. And the training, CPR training that's being offered over here, first aid training, getting to know your neighbors, forming new relationships through the organizations you meet here is going to do more to prepare your family than any individual piece of equipment or gear that might be out of your budget right now, but might be something that you can afford in the future. So focus on what you can learn and who you can know today, rather than necessarily all the gear that you may not be able to afford at this time.
Thanks, Ron. Meredith.
Thank you. I'll agree with Mark and expand just a bit. I think for those city offices and your first responders, the takeaway is to collaborate and look around at your table and make sure that there are disability voices at the table when you're making those plans. Make sure that you aren't tapping in one individual with a disability and saying we've checked that box. So making sure that you are genuinely connecting and hearing voices from the disability community. For the disability community, the takeaway is when you're invited to the table, take your seat and let them hear your voice. Ask to be invited to those tables. Put yourself in places where you can be invited, and make sure that you accept that space and take up that space that you've been offered.
Thank you, guys. I think ditto all of that, what y'all are saying, right? Preparedness is a 365-day-a-year job that we need to be doing, and knowledge is power, right? Understanding resources, options, programs that might become available to help support your needs and your family needs, resident needs, is critical. So learning more and more that you can and what's provided, and asking the right questions to the right people is how you get informed, right? Advocating for what you need and putting people on the spot if you have to. Like to do that a lot, but so I want to thank my panelists today for being here, and Lex and his message. This will be recorded and be available online as a resource in the future. So thank you guys very much for being here, and I hope y'all enjoy the rest of the expo.